Just to start, to tell you a little bit about what integrative medicine is, because many people don't know. Integrative medicine is a combination of evidence-based treatments in combination with your conventional therapies. And these are all to improve your health and support the healing process as you go through treatment and as a survivor. As a patient in integrative medicine, you become a partner in planning your course of treatment and what you choose to help you the most. So for everyone, this can be completely different. Some different services that we provide here in the integrative medicine clinic include acupuncture and massage, exercise and nutrition, counseling, stress management, meditation and mindfulness services. And then what I do as a pharmacist is guidance regarding safe use of vitamins and supplements. So with that, I'm going to share my screen. Okay, so I'll start with telling you what are dietary supplements. Dietary supplements include things like vitamins, minerals, herbs, botanicals, enzymes, amino acids, and many other ingredients. There is a big lack of FDA oversight with these type things, supplements and vitamins. So you have to be very vigilant when selecting vitamins and supplements. There are many meaningless claims, such as FDA-approved laboratory, pharmaceutical grade, clinically tested ingredients. There are a lot of claims to treat or cure disease, and supplements are not approved drugs. There are many proprietary blends and complexes on the market. Typically, these have subtherapeutic amounts of the key ingredient. So the CDC says that half of Americans use supplements. Studies indicate over 80% of cancer survivors report using a dietary supplement. There are probably many more because in many cases, patients don't think to mention the use of vitamins or supplements because they don't consider it medication. Supplements can both augment and interfere with conventional drug therapy and other treatments. So these, although many people consider them safe and natural, they can be very dangerous due to drug interactions and side effects. Some other dangerous consumer beliefs, a 2018 Harris poll sponsored by the American Society for Clinical Oncologists found that nearly half of Americans believe that cancer can be cured solely through alternative medicine. A 2021 study published in the Journal of the National Cancer Institute found that 1/3 of the most popular articles on cancer treatment posted to social media in 2018 and 2019 contained false, inaccurate, or misleading information that is often harmful. These included claims such as lung cancer can be cured with cannabis oil and golden berries cure and prevent cancer. A 2017 study found that rejecting conventional care and choosing alternative medicine alone increased the risk of death by 2.5 times. So I just want to point that out to you that here in the Integrative Medicine Clinic, we 100% support your oncologist and conventional treatment along with the things that we have to offer. So safety is our primary consideration. Herbs and supplements are very lightly regulated, allowing dangerous products on the market. Poor quality herbal products can be contaminated with many different things like bacteria, heavy metals, and fungi. The words all natural and organic do not mean that any supplement or vitamin is safe. So we ask that you always consult with a medical provider before starting any new supplement. You can purchase supplements almost anywhere nowadays, even at the gas station. So finding a place to purchase quality supplements online or at a store is very important. We recommend several different sites to purchase. With this being said, every supplement that you can purchase from these sites is not necessarily a good quality supplement, but Vitacost.com, iHerb.com, and evitamins.com are several of the places that we recommend. Not all brands and products are quality brands and products from these sites, so we still want you to seek finding a quality product that's been tested and recommended. And we have received multiple reports from places like Amazon where third-party suppliers have reported counterfeit products. So I do caution people from ordering from places like Amazon where they might be getting a bottle that's labeled with a certain brand, but doesn't necessarily mean that that is what you're getting in the bottle. So some common mistakes that can be made with supplements is duplication of products. This we see very often when people take things like a multivitamin and then another supplement on top of it. So you could be getting a lot more of any given ingredient than you think you are because you don't see all the separate ingredients on the back of like a multivitamin. Buying low quality products. Like I said, many things can be contaminated with bacteria and other contaminants. Using too many supplements. More is not always better, definitely in this case. There is the potential to duplicate ingredients by using multiple supplements, as well as an increased risk of side effect. And finally, taking supplements that interact with prescription medication or a disease state. So some things that would apply here is like fish oil can increase the risk of bleeding. So we would recommend fish oil in many patients, but specifically, it has to be recommended for any given patient because of the dangers. There's also a risk of hypoglycemia with some supplements in diabetic patients. Some other common mistakes with supplements are using supplements that could interfere with lab testing or procedures. So like I mentioned, fish oil can increase bleeding risk. So it's always recommended to stop fish oil or omega-3s prior to a surgery or a procedure. Another common supplement that could interfere with lab testing that is not very well known is biotin. So in cancer patients, many times biotin is used to help with the strength or hair growth for hair and nails. Biotin can actually give a false low TSH reading. So when you have yearly lab work done, you would want to stop biotin at least 1 week prior to that lab work. Taking supplements for weight loss. We get many questions asking for recommendations for weight loss. There's no clinical efficacy shown for any supplements for weight loss, and we strongly encourage a healthy diet and regular exercise. There is much more data to support these than the use of any supplement. And finally, spending too much on worthless supplements. So like I said, proprietary blends and all of the multi-level marketing products. Not to say that none of these products are good, but most often they're very expensive. And in many cases, they don't contain enough of the active ingredient to actually be effective. So this is an example of a supplement label. This is from a bottle of omega-3 or fish oil, as you might know it. Just some things to look out for on any supplement label or vitamin label on the back. So number 1 is going to show you the serving size. This is important to pay attention to because many times you'll look at the serving size and it may be the amount in 3. And so you pick up the bottle and take 1 a day thinking you're getting that dose. And you actually need 2, 3, or even more of the tablets or capsules to get that amount. Secondly, you want to look for other ingredients in your supplement. So this is a bottle of omega-3 or fish oil, but you can see it also contains vitamin E. So you always want to be aware of what other ingredients are in your supplement. Number 3 shows you the total amount of omega-3 or fatty acids. So this tells you 1,200 milligrams. And then below it gives you the amount of EPA and DHA. So these are the active ingredients, and you do want to make sure that you have a substantial amount of these adding up to the total milligrams that you are receiving. Then number 5 just tells you that this is reported as the ethyl ester form. So there could be some other information here. And then lastly, under other ingredients, you want to watch out for this. This is not labeled on here, but other ingredients could tell you where if it contains soy, gluten, other ingredients that people commonly have allergies to. And then lastly, under the purity guaranteed, this is going to show where testing for impurities, potency, contaminants by independent FDA registered labs, which I'll talk a little more about later. So how to read and compare supplement labels. This shows you a bottle of Nature Made Calcium, which is a brand that we do recommend. You can purchase this. You've probably seen it over the counter at your local pharmacy. On the front, as you can see, there's no mention of what type of calcium this is. Not all products are created equally, and not all forms are the same. And this is something that with an ingredient like calcium can affect the absorption a great deal. So this is an image of the back of the bottle, and it tells you the suggested use is 1 soft gel 1 to 2 times daily. This is not going to be the same for all patients. And so this, like we said, it is not recommended by the FDA. It's not a drug. It's not a proper dose. So we do ask that you ask for guidance on how much you would take of any given supplement. Your serving size on this would be 1 soft gel. And then, as you can see on the back, this contains vitamin D, whereas the front of the bottle, it's really tiny over here with vitamin D. But some people may pick this up and not realize that they're getting vitamin D along with their calcium. And lastly, under other ingredients, you can see here, this contains soybean oil, gelatin, glycerin, some other ingredients, does contain soy. So how can we learn more about supplements? There are several good options here. Consumer Lab is a third-party testing agency with a lot of evidence-based information. Anyone can join this site, Consumer Lab, but there is a yearly fee. But like I said, there is a lot of testing information, gives options for good quality brands, and a lot of information about different health conditions and disease states with different supplements and vitamins. Secondly, we have Memorial Sloan Kettering site about herbs, the American Cancer Society, dietary supplements, what is safe, the National Institute of Health, National Center for Complementary and Integrative Health, and finally, drweil.com. So Dr. Weil is an integrative medicine doctor who pretty much started this in the US, and he gives many podcasts and lots of great information on this website on many different topics, health conditions, and supplement. Some more ways of how to find a quality product. Always consult with a trusted healthcare professional with knowledge of these products. We always review your medical record prior to meeting with you, and we do ask that you bring all your supplements with you. So if anyone comes into the integrative medicine office, like I said, we work very closely with your oncologist so that we know what medications you're on, what supplements and vitamins you might be taking, what other treatments you're having, such as immunotherapy, radiation. These things can interact with supplements and vitamins just as much as other medications can. You can check Consumer Lab to see if a particular product has passed independent testing. They test many different brands of products, but they don't test all of the products. Obviously, there are way too many. Avoid multi-level marketing companies, as quality may or may not be good, but as I said, the price is usually way higher than a much higher quality product that you could purchase. And generally good quality supplement brands. So this wouldn't stand for every supplement, every vitamin, but these are some that typically we see as being good quality brands. Nature Made, Nature's Bounty, Carlson, Now, and Pure Encapsulations. I'm going to talk a little bit about vitamin D and cancer. Vitamin D could have a protective effect against cancer and is important for your bone health, heart health, and to reduce inflammation. Vitamin D deficiency is very common in cancer patients. In almost all patients that we see in our clinic, we do recommend that you have a vitamin D level done. And if it is low, to supplement to get in an optimal range. We usually recommend between about 40 and 60. So vitamin D lab is typically not covered by insurance. And this is a lab that in most cases your primary care doctor would have to order. It's not a lab that most oncologists look at, but it is very important to try to have this checked through your primary care doctor. So sleep deprivation is a major cause of fatigue in many cancer patients. This can be due to side effects of not only chemotherapy, immunotherapy, radiation, and just the general fatigue that comes along with the diagnosis and the multitude of appointments that you have to go through. There are many OTC products available for sleep. Many of these contain Benadryl, otherwise known as diphenhydramine, and other antihistamines. Long-term use of these type sleep aids has been linked to dementia, increased confusion, and risk of falls, especially in older people. So most products over the counter that you will see for sleep, like Advil PM, Tylenol PM, will contain Benadryl. It's a very, very commonly used sleep aid, diphenhydramine, you'll see on the back of the package. And we do caution use of this. This also can contribute to dry mouth, which is a very common side effect that we find patients looking for remedies for. So a better option, a safer alternative for sleep is melatonin. Melatonin is a hormone produced in the brain to regulate the body's natural sleep-wake cycle. There is also some evidence, and a lot more coming out recently, that it could have anti-cancer benefits. We do recommend you start with a very low dose. I typically recommend starting with 1 milligram and then increase up as needed, but no more than 5 milligrams. Higher doses of melatonin have been actually shown to be more detrimental to sleep and can leave you feeling groggy and not very well the next day. It's recommended to take it about 30 to 60 minutes before bed. It's not a quick fix where if you go to bed and take it as soon as you lay down, it's going to make you sleepy right away. Some good quality brands that we recommend of melatonin are Nature Made, Now, and Trader Joe's. So some studies have shown that long-term use of high doses of some supplements can actually increase lung cancer risk in current and former smokers. So some of these are vitamin A, beta carotene, or retinol, other forms of vitamin A. This would not include what you would get from foods, but supplements. And then also vitamin E. Vitamin E has been shown to actually increase risk of hemorrhagic stroke in lung cancer patients who are current and former smokers. What does Novant Health Integrative Medicine say about supplement use? So we do not have a defined rule about supplement use during cancer treatment. Every patient is different, and so the general guideline is to avoid antioxidants during chemo and radiation therapy, but eating an antioxidant-rich diet is encouraged. So we almost always get this question when we tell patients we recommend you stop multivitamins during chemotherapy and radiation, because they could interfere with your treatment. And people will always ask, well, is it okay to eat the foods that are high in antioxidants? It is totally fine to eat the foods high in antioxidants, and we actually encourage this type diet. We usually encourage people to avoid fish oil during chemo and radiation. Like I stated previously, this is because fish oil can alter or affect the blood counts, and then it can also increase risk of bleeding. Supplements could interact with both prescription and non-prescription medications. And then finally, always check with an integrative medicine provider for guidance prior to using any supplement. So that wraps up my presentation, but just to encourage you, anyone is welcome to reach out to us. You can contact our clinic directly. We do have physician, we have acupuncturists, we have massage therapists, physical therapists. Trying to think if I'm leaving anyone out here. So we have a multitude of specialties here, and we just encourage you to reach out and try to help with side effects from your treatment, try to prevent any harmful drug interactions or decrease in efficacy from your treatment. And we would be happy to work with any of you, any questions you have. Your oncologists or your nurse navigators can put in referrals for integrative medicine. You can also contact our clinic directly.
Thank you, Dejan. Thank you.
Yes.
It looks like we have a number of questions. I'm going to go ahead and stop sharing. Did everyone get the information here? I will also add the phone number in chat after we are done here. But let me go ahead. But it looks like we do have a number of questions and comments. So I'm going to start first with said it's hard to know if effective when it works on a cellular level. Do we rely on Google reviews and similar reviews?
So definitely, I would try not to rely on Google reviews and social media, especially because as proven, there's so much harmful information out there, and you'll always have family and friends telling you, I saw this works, and just all of the false claims about different things that can be used to treat and cure cancer. And it can be very unsafe, and try not to read things like Dr. Google and social media.
Okay.
Yes, I put that question in before you mentioned some companies you use. But then you also said it doesn't mean that each one is a quality one. So I was wondering, how do you know?
Correct.
Because it's, most of them you don't feel it's working, when you're inside you.
Yes. And because everyone is different, that's a big part of what we do, and working up each patient independently to see their specific regimen, and then to see not only what drug interactions there may be, but what interaction there could be along with radiation or other treatments. And then to see what quality products we recommend specifically, because there's always new quality testing being done. And so one product may be quality tested last year, but this year it may not be the case.
Thank you. Thank you very much. This is great.
Yeah.
And in any case, there are so many different ones out. We would actually check specific ones. Also on Natural Medicine is another site we use that will give an evidence-based rating for different products. So we screen in a multitude of places. I can't say across the board Life Extension is a good brand, or even, Nature Made, who makes a multitude of vitamins, is a good brand. Just typically, those are some quality brands that are third-party tested and are top picks by Consumer Lab.
What about getting vitamin A from drinking carrot juice every day? What are your thoughts on that? So
as long as it's through foods, it is safe to get those vitamins, both A, E, beta carotene, retinol. So consumption through food is safe.
I have heard so much about vitamin D and how important it is. And so I really thought it would be harmless, and I didn't think I could get enough. They were talking, there was talk about it helps with COVID and many other things. And so I bought some. I thought it was every day. And so I was taking it every day. And then when I saw my oncologist, she I don't know why, but she just said, I'm going to test your vitamin D, because she thought it was low. And then she tested it, and I had a toxic level. It was 154. And then I realized that I was taking it. It should have been once a week. So anyway, I just wanted you to talk about the harms of excessive amounts of vitamin D.
So as with any vitamin and supplement, it is possible to get too much. Vitamin D is a fat-soluble vitamin, so your levels can get too high. That is part of the importance of trying to have that lab checked, and it's not always checked. We do, when we screen a patient prior to meeting with you, we do look for those labs, specifically vitamin D, sometimes vitamin B12, depending. And it can be too low, but just as easily it could be too high if a patient is taking more than they should be. So every patient is different. I can't say a specific dose. A typical starting dose that we would recommend would be 1,000 to 2,000 units of vitamin D a day. But like I said, that could be too low for some people and too high for others.
And also you mentioned, I think you said it's fat soluble. And I'm not exactly sure what that means, but I would say this, that even though I have stopped taking it, and also you mentioned all these other supplements have, a lot of them have vitamin D in. I didn't even know I was getting vitamin D until later, after the fact, I realized that. But also it seems like it's taking a very long time to get out of my system. Is that from the fat soluble, or how does that work exactly?
So fat soluble vitamins would be those that your body can I guess, hold too much versus non-fat soluble vitamins. Usually you would excrete out what your body can't use. So vitamin D particularly, others are vitamin A, vitamin E, and vitamin K. But we very rarely, I will say, we very rarely see a patient with a high vitamin D level. So it is not common, but if you were taking, you said you were taking 10,000 a day.
Yes.
It's one of those things where it is easily confused too. Oftentimes we'll see a patient come in with a bottle, and prescription vitamin D is prescribed to be taken once a week typically. And you'd be surprised how many people might be taking it daily. So with that being said, there are two forms of vitamin D, vitamin D2 and D3. Vitamin D3 is the over-the-counter form, and it actually has been shown to be absorbed as well or better than the prescription vitamin D2.
I know that there are some vitamins that I guess they help with the absorption or so forth.
Yes, so vitamin D is very important for bone health. It helps with the absorption of calcium into the bones. Some others that are important along with calcium are magnesium. Mm-hmm. And in some patients, we recommend a vitamin K2, which is a little less commonly heard of. But I typically only recommend that in my patients who have osteopenia or osteoporosis.
I'd like to know if there is any evidence of magnesium level being related to cancer or chemotherapies. Do magnesium supplements, and what for magnesium she's asking about? So is there any evidence of this?
So often magnesium levels do get very low during chemotherapy treatment. That is a lab that your oncologist monitors regularly prior to each infusion. And we usually recommend a magnesium supplement to all of our patients across the board, not just for bone health. It's also a natural muscle relaxer. So it can help you get more restful sleep. And because the levels do usually decrease during treatment, in many cases, this can prevent you from having to get a magnesium infusion. There are different forms of magnesium, and we base them on each patient individually, which form we recommend. Some can be more, some can be better for a patient who is suffering from constipation versus another form of magnesium would be better for a patient suffering with diarrhea because the side effects can be so different.
What is K2? This is new to me.
So vitamin K2 is actually used in Asia to treat osteoporosis in some cases. It has beneficial cardiovascular effects as well as anti-cancer benefits, and then for bone health. So several different good uses for vitamin K2. However, if you walk in any pharmacy, a retail pharmacy, they probably will not have K2. And if you ask the pharmacist for it, they probably will not know what you're talking about. Vitamin K2, usually you have to order online. And we do have a lot of these supplements available in our office as well. So we can point you in the right direction with those. But vitamin K2, again, helps the absorption of the calcium into the bones.
So that she's been taking 3,600 milligram of turmeric curcumin by Sash Vitality per day. And it's really helped her peripheral neuropathy. Mm-hmm. Is this a...
The curcumin I'm taking also has black pepper, which is supposed to help the metabolism of the curcumin.
So black pepper can aid in the absorption of turmeric or curcumin, but I do caution you, we typically don't recommend a product with black pepper because black pepper has many drug interactions with other medications. So there are some other forms of curcumin and turmeric that are formulated without black pepper that are well absorbed. So we can recommend those. Theracumin is one, and just caution, turmeric is not safe in all people, and it is one of the things that we recommend avoiding during chemotherapy and radiation due to the blood thinning effect.
Are there any other, just off the top of your head, Dejan, that you would say, hold off? for that same reason or some other medical interaction reason? Anything else that a lot of us might be on, think these supplements might be on our shelves?
The most common ones would be multivitamins because they do contain the antioxidants. And then omega-3 fish oil and turmeric would be big ones too that we very commonly see. A couple other ones, St. John's wort has many drug interactions. We don't want to see people on that. The list goes on and on. There are many that interact with chemotherapy, but we specifically would screen each patient to see what they might be on that could interact.
Yeah, she said about a multivitamin. Now, don't take a multivitamin. I mean, the doctor told me to take it. So, and he said just to supplement stuff that the multivitamin didn't have enough of.
So we recommend holding a multivitamin during treatment. And then once treatment is complete, you could pick back up with that.
So I would suspect that there's a lot of patients who don't tell their doctor either because they don't think it's relevant or because they are afraid the doctor is going to tell them to stop taking something that they really believe in taking. Could you address that? I know you touched on it during your presentation.
We always err on the side of caution in our clinic. And if there's anything that could theoretically interact with or interfere with treatment, then we just recommend that you stop it. With any recommendation that we give a patient, it's just advice and it's a recommendation. We do not tell you, you must stop this, you must stop that, you have to take this, you have to take that. It's completely up to the patient, and we strongly encourage you just to share anything that you take with your oncologist as well and make sure that they're aware of all the supplements and vitamins that you're taking.
She's wanting to know, when you say during treatment, Dejan, are you also including targeted therapy or immunotherapy, something that they're taking daily?
So
For years.
Some things can interact with that or interfere with immunotherapy, but specifically with the antioxidants, like a multivitamin, we would just say during chemotherapy and radiation.
What about milk thistle and ALA?
So the list of supplements that I could go over is endless. And I want to use caution here because things like that can interfere with different supplements, prescription medications, treatments. So like ALA, we do commonly recommend for like neuropathy, but again, it can have some blood thinning effects, can interfere with other medications. So I don't want to make an across the board statement on those specifically. It would have to be patient specific.
So if I'm at, you are in Charlotte, but and this is a national group, so we have people from all over. Chances are my medical facility should have someone like you to help me with, if I come in and I say, hey, so I'm thinking I might want to take milk. I was reading online, and all these people were talking about milk thistle. What do you think? I can make an appointment with someone like you? Is that most likely?
So I can't speak for other facilities because I don't know that each facility would have a pharmacist on staff to answer those questions, but definitely. And we do also have virtual visits. We can do visits through Zoom or through phone. So for patients who are not local and can't come in.
What about the metallic vitamins and anti-chelate?
Chelate. Like vitamin B3, niacin, thiamine, they're all in multivitamins, but my integrative care doctor told me, except for, I think, Olympia, there's one drug where you need to take one of them. But other than that, he said to try to keep those levels low. Do you know that theory, or can you speak on that?
So
thank you.
You'll find a lot of those minerals in a multivitamin. In some cases, you can still get too much of some things too. For instance, zinc is a big one that we caution people with taking high doses long term. It can lead to copper deficiency. So it's just one of those things where there's a fine line about too much or too little and staying within normal limits.
Yeah, I'm just wondering about, like, we have no choice but to go for these CT scans with contrast every so many months. And I'm just wondering, are there supplements we should be avoiding when we're having the iodine, or is there something we should be doing to help get it out of our system, something we should be taking after these tests? I'm always worried about the buildup.
Not to my knowledge. That would probably be a question that you might speak specifically to your oncologist or radiologist that's ordering that test.
Okay, and there's nothing that you're aware of that we should be avoiding, like, I don't know, so many days before the test, or
Not specifically for a CT scan, more for an invasive procedure or a scheduled surgery. Those are the cases where we would recommend that you stop certain things due to risk of increased bleeding.
Is there anything to avoid with bromelain?
To avoid with it, I would have to screen for drug interactions with, do you mean with other medications, supplements?
I think maybe with a statin, because it's like the pineapple enzyme. So I don't know. I was wondering about that. I haven't been able to get a lot of information on that.
So I just quickly put in Crestor, which is rosuvastatin, since you said a statin. I don't come up with any interaction with bromelain and that medication.
I'm wondering about CBD products.
So with CBD products, you have to use caution because there are so many products on the market that are not tested for quality. They're not FDA approved. You just have to be very careful with, if you do choose to use it, using a good quality product. And we also caution people when using those products that there is always that chance, if you do have a drug test, that you could still test positive. It has happened. So
what are some of the supplements that you would recommend for neuropathy? And again, I know it's on a case by case basis, but just
there's several things for neuropathy. But again, we usually wouldn't recommend some of these until after treatment. The most effective thing for neuropathy is actually acupuncture. And we do recommend that our patients seek acupuncture for neuropathy to find that very helpful. Supplement-wise, alpha lipoic acid is often used. In some cases, capsaicin cream. And then some of the B vitamins can be helpful for neuropathy.
Is there anything that you would even suggest for phlegm and mucus production, or to make it thinner, or it's my understanding that as long as I have cancer, it's not going to go away, that it'll always be here. So I'm constantly having to cough it up and out. Can you speak to that at this time?
So that probably is going to have to be managed through your oncologist as well. But some ingredients like wifenicin, which is an expectorant, can help to thin mucus in some cases. And then just to make sure that you're drinking plenty of water and staying hydrated, that can help as well.
And what was the name of that what?
Stay hydrated by drinking plenty of water. Mm-hmm.
But you said something prior to that.
Wifenicin. So Mucinex.
Oh, wifenicin. Okay. Okay. Thank you.
You're welcome.
I found that adding a humidifier in my bedroom at night has helped a lot with mucus and phlegm.
One more question, if you don't mind, about a lot of lung cancer patients have a cough that just won't stop, and it's maybe non-productive. Some of them get prescribed those little pearl drops or something, but do you have any suggestions for something that might help with a non-productive cough?
Not specifically from a vitamin supplement standpoint. I mean, there are multiple lozenges and things like that that could be helpful, but honey definitely. Some people find help with honey lemon tea using thyme, the herb. And then there are also, like, biotin has a mouth rinse and spray that can help with dry mouth. That sometimes is a side effect that can lead to that. There's something else called Xala melts that attach inside the mouth to help with that. And then trying to stay away from any toothpaste that's alcohol based that can contribute to dry mouth and problems.
Well, now you've got me going on another question. I'm so sorry about it. I think we just might need to extend this session. So the toothpaste, and a lot of times people going through chemotherapy and or radiation treatment, they get mouth sores and esophagus sores. Any recommendations or suggestions for dealing with that?
So I have a whole long list of recommendations for that, but I would probably want to make it a little more patient specific. But some of the big ones, would be the Biotine mouth rinse. Also, to help prevent mouth sores, even keeping ice in your mouth during the infusion of the specific chemo that's causing it can be helpful. So I recommend taking a big cup of crushed ice, and just that can help prevent those mouth sores. Make sure you're using an alcohol-free toothpaste. Like I said, the mouth rinses. Chewing on a stalk of celery is a really good, easy, natural way of preventing dry mouth.
Do they still make Magic mouthwash?
So Magic mouthwash is a compounded mouthwash. It's a combination of several ingredients, and usually that'll be prescribed if you do have a mouth sore with infection or with a lot of pain. They sometimes add lidocaine to it.
I did, but a friend of mine got them through chemo, and my sister had recommended it. She got it from her doctor, and it helped.
It's a lot too.
Anytime that you do get a mouth sore and it's not healing right away, or any sign of infection, thrush, you would want to make your oncologist aware so that they could treat that.